The Health Minister Zweli Mkhize, as you know, is on special leave. President Cyril Ramaphosa temporarily excused him from his duties following allegations around the Digital Vibes contract. The Tourism Minister, Mamuluku Ngubane, has stepped in to act as the Health Minister. With the country battling a deadly pandemic, how much of an impact will this have? Now, the medical expert and convener at the Progressive Health Forum, Dr. Aslam Dasoo, joins me now for a discussion on this. Dr. Dasoo, I've got to thank you for your patience as well, because you have been holding on for a while we were wading through some of the issues to do with elections. How much of a spanner in the works is the Minister of Health going on special leave under these circumstances? How much of a spanner in the works is it as we enter the third wave of the virus?
Good afternoon, Thulasizwe, and to your viewers. Look, I think we'll know shortly. As you mentioned, we are moving into the third wave. There are a number of moving parts here, not least that we have quite late in the day in terms of our major strategy to protect the population, and that's vaccination. But his departure from the portfolio is a cause for some consternation, because he has, for whatever else one might say, there is a great respect for him at a personal level among health workers. And health workers, as you know, are demoralized and they're very beset right now. And so you need someone with the requisite leadership skills to be able to give them some comfort. So we come down really to two metrics on the whole situation. The first is leadership, and the second are the measures to protect the population. And I think your question relates to the issue of leadership. And Dr. Mkhize has demonstrated that. Despite the fact that we've had a less than exemplary management of the pandemic, he's not the only person in the government, and there are many parties to it who have made several missteps that bring us to this position. Although it must be said that as far as protecting the population is concerned through vaccination, it's been really the Department of Health that has let us down quite badly.
And so does it matter to you as health activists that the President has appointed the Minister of Tourism, Mamuluku Ngubane? I mean, from what you know of his public work and public profile, of her public work and public profile, what do you make of that choice?
Look, I'm sure the minister is talented and skilled in very many things. However, you would not appoint a person who doesn't have some legal training to the portfolio of Minister of Justice, would you? So why would we want to accept that someone without any medical training or healthcare insights be appointed to this position when there are alternatives? But it is the President's prerogative, and he needs to explain this. We can't certainly make much sense of this. Given the situation we're in right now, in the third wave, we needed someone who is able to grasp the deep complexities of the management of this pandemic right at the get-go. And I don't think we've got that. But it is what it is. So for all of us right now, we must accept that we have come this road, unfortunately, with several missteps. We are now late in the day, but we can't go and undo those things. We now have to make sure that whatever we do is protective of our population, protect them from this very deadly pathogen. So all hands on deck as far as that is concerned. However, I must make the point that other countries are also looking at it, and we must do the same. We must start planning for a commission of inquiry into our overall response to the pandemic. But that is for another day. For now, we are in a severe crisis. Our economy has not got little room for further restrictions, and with the upsurge in the number of infections and the practical overwhelming of health services being imminent, I think that's where our focus should be. And all leadership should have been focused exactly on that. Yeah. To this end, I do believe that the President himself needs to become the face of this entire effort against the pandemic and not leave it outsourced to committees and other ministers and other agendas that come into play as a result. Right now, we don't have sufficient vaccine in the country. Now, this is such a severe limiting factor to all of the preparations that we might have made. Even the B4SA, the Business for South Africa, SA initiatives with the government, is all about administration of vaccines, but not about acquiring vaccines. That has been left to a very narrow channel. So we don't have enough vaccines. We are certainly not going to reach any of the targets that have been put out. And this is a real worry for us. Right?
Dr. Dasoo, I know you said that the conversation about needing at some point in the near or distant future, or, at some point in the future, a commission of inquiry into our overall response to this situation. I know you said it's a conversation for another day, but tease it out a little bit more for me. What's led you to the conclusion that this is where it's headed, that it will be necessary for us to have a kind of commission of inquiry in future?
Well, look, we're a constitutional democracy. And what the government does or does not do that impacts on the lives of people is a necessary arena for examination, always. So the way we have now managed this pandemic, of course, we learned on the way. We made mistakes that were inadvertent, and most countries did that. But those who have taken the view that they need to review their responses. The WHO has also done that. I think we are beholden to do exactly the same thing if we are going to find out where we went wrong. Because this is not going to be the last of the pandemics we face. We are now in the age of pandemics. So we need a much better handle on how to move in that situation. The fact that we didn't even have a vaccine program until the end of last year, 1 year into the pandemic, is a serious indictment. The fact that it's taken us 6 months to get just over 1 million people vaccinated, when this is routine, 1 million people vaccinated daily in countries like the United States, there is a serious deficit here. So to have one of the lowest vaccination rates in the world, as well as one of the highest mortality rates from COVID in the world, in one country, is a correlation that we shouldn't have had to face. So there must be some answers to this, and there must be accountability for this. And that is why a commission of inquiry will be vital at the right moment.
All right, thank you for your insights there, Dr. Aslam Dasoo, a veteran campaigner in the space of health. I mean, he goes back all the way to the last years of apartheid, the campaigns around desegregation of public health facilities. And of course, at some point, he was the late former President Nelson Mandela's doctor, weighing in. He continues to campaign, weighing in on the situation around the health minister, Zweli Mkhize.